that's, it's working again now. So I think we're good. Hey everyone, and welcome to Chef AJ and Friends. Today is the fourth Monday of the month, which means it's time for Goodbye Lupus with Dr. Brooke Goldner. Please welcome her back to the show. Hi there. Good to see you as always.
It's good to see you too. You're looking good.
I always think about wearing purple when you're on. So that's your favorite.
Wearing it anyway, but I'll take it.
Is that your favorite color?
It's definitely one of them. I like it because it's lupus awareness color, but I've always been a fan of purple. I like bright colors a lot.
Nice, good, because your birthday present is purple, so I'm glad that
the Aquarius thing, right?
I'm glad I confirmed it's your favorite color. So you chose an interesting topic. That's something I'm passionate about lately, but specifically why so many young people are getting cancer, and I'd love to know.
Yeah, it is something that they've been noticing. And listen, I'm going to say this right out the gate that in general, young people are sicker than they ever were. It's not just cancer. When I was diagnosed with lupus, I was 16 and I was told I was young for the diagnosis, the youngest my doctor had seen. And this was in the 90s. Now, I regularly have clients with lupus who are anywhere from 2 years old. 9 years old is a very common number lately, 11 years old. So people in general are getting sicker younger. And I want to say that right out the gate, because a lot of times people get so focused on one disease, they're not seeing the pattern for human health. It's going the wrong way. Even when I was in medical school, they told us that they were expecting the next generation to be the first generation that didn't outlive their parents. Whereas every generation previously, because of improvements in health and medical care, every generation was living longer. And we kind of hit that and started to come back the other way. So generally speaking, that is the case. But the numbers are pretty alarming for cancer in that we are seeing, in general, cancer numbers have gone down for most age groups. But in one age group, the numbers are going up instead of down, and that is in young people. So that is a really unusual thing, that people under 50 have increased rates of cancer now. 17 different types of cancer on the rise in young adults. And that is unusual, right? It stands out. Young folks now getting colon cancer. That used to be something you saw in older folks in their 60s. Now we're seeing it in the 20s. Breast cancers, pancreatic cancer, other types of cancer. So they're definitely on the rise. And so one of the statistics I saw is that for patients younger than 50, which, that's still considered young, that their cancer rates rose by 79% and 28%, depending on which cancers you're looking at, between 1990 and 2019. That's a huge increase. The most common increases in breast cancer, but also colon cancer, pancreas, stomach, also dramatically on the rise in that age group. One study said that young adults are twice as likely to be diagnosed with colon cancer and 4 times as likely to be diagnosed with rectal cancer as those born in 1950. So we have to take notice of this because, generally speaking, we like to think that medical technology is improved. We have better ways of finding cancers, treating cancers. They should be going down. And yet in this one age group, we're seeing it go up. Now, it's still an older person's disease by far, cancer. 88% of people diagnosed with cancer in the US are 50 and older. Still, as of this year, 59% were 65 and older. So it's still an older person's disease, but the trend is what's important to recognize. And so we're trying to figure out why. And nobody knows yet. I'll put that right out the gate. Nobody said, absolutely is this. There's a lot of theories out there. So I thought we could just talk about that. What are the theories that we have? And also, what do we have power over? Because if you know me, I like to talk about what we have power over, what hope we have to have a good life, and not just freak people out with scary statistics and create anxiety for people, right? But there's definitely, it's been baffling a lot of doctors trying to figure out, why exactly we're seeing this, especially in healthy people. There was one study I was looking at where they were saying that a lot of the people who are getting cancer younger are also people who should be healthy. They're vegetarian, they're swimmers, they're not smoking, they're not doing bad things. Why are their numbers going up? So there's a lot of theories. One of the big ones I hear people talk about are the microplastics. Everyone's scared of microplastics nowadays. What that is they found that all of us now have some level of plastic in our bloodstream. It's kind of creepy to think about, but it is the case. They don't yet know what that means for our health. But starting with babies drinking bottles out of plastic bottles, all of the food we eat is in plastic. My containers of Power Greens are in plastic. I mean, it's in the ocean. It's everywhere, but we still don't know what the impact is, which then raises the question, could that be a part of it? And again, we don't really know. There was one researcher who was looking at how microplastics affect the gut lining. And his name is Dr. Frizzell, and he was looking at how people who have that microplastics affect the gut lining and permeability, and it encourages the growth of a certain type of bacteria, which then combined with red meat can dramatically raise your risk of colon cancer. So it might be that the microplastics are making us more vulnerable to the negative impact of other things in our life that are creating cancer. So I found that to be really interesting, because we already know red meat is a risk factor for colon cancer. In fact, even when I was in medical school, even 20 years ago, when they said risk factors for colon cancer, they said it was red meat and low fiber diet. That was before we even knew what plant-based was. So they're saying that it might be that it creates an environment in your gut that makes you more vulnerable to carcinogens, like red meat, for example. So maybe that's going to be the case. This is one researcher, but it's something that could make sense, that maybe people who are exposed to carcinogens already, maybe microplastics have a role in that and how it affects our gut permeability. Again, it's still a new science. We also have higher rates than ever before of ultra-processed foods in people's diets, and very high rates of unhealthy eating, higher rates than ever of people eating things like, fast foods. When I was a kid, that was maybe a once in a week thing. Nowadays, there are people who eat it every day. I actually had a client recently who every day had breakfast and dinner at Chick-fil-A.
Wow.
Every day. Because it was easy. On the way to work, picking up breakfast, on the way home, picking up dinner. So it's become very easy. You can have it delivered to your door. Even through the pandemic, a lot of people got very used to ordering in through, just that was their comfort, and they kept doing it. Very high rates of obesity out there. And again, we see it affecting people in other areas. Like we've talked before about how the rise and spread of the Western diet exactly can predict the rise and spread of autoimmune diseases all over the world. They follow the same trend, that as Western diet's been introduced to places like the Middle East, they also now have autoimmune diseases like ulcerative colitis and Crohn's that they didn't have before. So if we follow that trend, that would also make sense for some of the increase that we're seeing in things like cancer. So we have a lot of carcinogenic products in our life, people who are eating meat, ultra-processed foods, drinking alcohol, all the things that they were doing before. And maybe that's combining with some of the changes we've created in our environment. You don't need to be a weatherman to know that the environment's not the same as it was. We just had winter weather in Texas in February. It's supposed to be 80 degrees here, and it was freezing temperature. Our 30 degrees. What? Right? So we've definitely changed our environment in terms of the actual weather around us. There's a change in the environment in our bodies in terms of, yes, our exposure to plastics and other things. Who knows what? There's a lot more chemicals that people are using, both on crops and otherwise. So I think it does create. There's maybe more of a storm that's more likely to trigger people's genes for cancer and other things. Again, they don't have all the science down. How much is the impact from other chemicals in people's lives? We don't know. But I think that at least from what they're seeing so far, it does create a good case for taking control of what you can, right? That, all right, if microplastics might make your gut more likely to produce cancer if you eat meat, then you can at least make sure you're not eating meat and eat a diet that helps you be anti-cancer. Hyper-nourishment, which I teach, is all about giving huge dose of cruciferous vegetables to the bloodstream, which are known for and proven to kill cancer cells. So there's still things that we can do. And thankfully, we don't have to shift very much in what we're teaching in terms of optimizing people's nourishment. There's higher rates of trauma in people who have cancer. So working on things like helping people with their moods and their happiness and stress to their body, because as people have more depression, anxiety, and trauma, there's higher rates of inflammation in the body, which can then accelerate things like cancer. So it doesn't really change what we need to do. And so I thought it was important to bring up the topic to highlight that it is an issue. I do think it's important for people to go to the doctor and get screenings. It does make me nervous when I hear folks say, like, don't get your mammogram, don't get your colonoscopy, avoid the doctor. These are things that you can do to find out information. Yes, people get a mammogram. There's a high sensitivity and a lot of false negatives, but it's better to have, to get it and have to retest it and find out if there's a positive than to ignore it and maybe miss a cancer. I've had folks who've come to me who didn't get mammograms and they did other techniques and then ended up with just breast cancer that had already spread through their body. Colon cancer, you can get a colonoscopy, you can find out what's going on in there. So I do think that, especially with the risks on the rise, that we should lean into screening. I know a lot of folks don't like that idea, but I think that we can join what we know about medical technology and natural healing and health and do what we can to optimize your ability to not get cancer to begin with by eating a really good hyper-nourishing plant-based diet, working on your health in terms of your mental health, and making sure that you get screenings, especially if you're at risk. I think all of those things combined together is the best we can do. And we're still allowed to enjoy our life and not freak out over every little thing because there's always things to worry about, but it doesn't necessarily contribute to better health. So that's the update that I've been reading about, because I have been paying attention to this. Anytime we see a trend in disease, I'm looking at that. And as I said, the trends seem to be the same, whether it's cancer in younger people or depression in younger people, autoimmune diseases in younger people. There has been a trend to worse health, but that hasn't changed people's ability to recover, at least in my world, whether they came from serious trauma or whether they just had a diet where at 2 years old, they're eating nothing but macaroni and cheese and hot dogs, that those folks have been able to recover by working on really strict hyper-nourishing eating and self-care, in spite of having the same risk factors as everyone else around them in terms of plastics and all the other things that are in their environment. So I see a lot of hope in that as well.
Wow. There's so many things I want to ask you about what you said. I mean, the first thing that I heard is about, it's not just cancer. Young people are getting so many other diseases earlier.
Yes. Diabetes. I've talked about this before, how when I was in medical school, we had type 1 and type 2 diabetes. But we called it childhood onset and adult onset because kids did not get type 2 diabetes, because that was something that happened after a lifetime of unhealthy eating and getting obesity. But by the time I was finishing med school, they said, you know what, they're probably going to change the name because children are getting adult onset diabetes. So we have to change the name. So that trend has been in place for quite some time, that kids are sicker and sicker. And the biggest contributor is the food. I will never forget bringing my son Solomon to his Montessori class when he was 1 year old, and he's there with his fruit and his tofu cubes and his green smoothies, and these 1 year old kids are sitting there eating packaged products full of sugar and grease, gummy this and anything that says baby food on it, you can already count it out as unhealthy. But it's these chips and all this stuff. I mean, they are raised on processed garbage from the beginning. I mean, doctors still tell the parents to put them on, this rice powdered cereal as their first food, like processed food for their first food, which I didn't want to do. My kids had avocado as their first food. So we are raising generations now of kids that have grown up with processed food being the first thing they have. They now consider baby formula to be ultra processed. But it makes sense. The first ingredient in baby formula is corn syrup. So, when we have kids that have been raised this way from the beginning, then I don't expect their immune systems to function properly. I expect them to be more likely to get sick. And then when you combine that with changes in our environment, whether or not the microplastics are driving it or not, there have been definitely changes in our environment, but also the diets are so awful. They have a higher level of stress. So all of these things combined, I think, make them more vulnerable across the board. And when we zero in too much on one disease, we miss kind of the big picture the worsening health of the generations of kids that are growing up now.
Well, you know, when you talk about screening, like, are there particular cancers that are more prevalent that the young people are getting? Because you're not going to probably do a colonoscopy and a mammogram on a 10-year-old, right?
Right. So they're seeing it more happening in their 20s, high risk of specifically breast cancers and digestive cancers, like colon cancer in 20s, people in their 20s. That was something that we would never think to do a colonoscopy in a 21-year-old as a screening back in the day. Even now, typically doctors will recommend that to someone who's in their 40s, maybe 50, but there's more and more cases coming out where someone's complaining of GI pain. The doctor thinks they have IBS. Finally, they get a colonoscopy and they've got cancer. And it's been shocking, I think, to the medical world to see that. But, it's not across the board. My son, Solomon, who you've interviewed him, he just shared on Instagram yesterday. He read an article that he reviewed there talking about, it was a study done looking at vegan kids and at their growth and at their hearts. And there was originally some thought that vegan kids don't grow as tall because they looked at them at a certain age and they weren't as tall as their median counterparts. And what they found was they actually do grow as tall or taller, but their growth is slowed down and spread over a longer period of time than folks who are exposed to all the hormones and meats and everything. But the other thing that they found was that the kids that were raised on plant-based diets had no risk factors for heart disease at the same time that their counterparts who were teenagers already showed blockages in the arteries forming, blood pressures going up, and all of these things. And I was proud of him for actually I watched him read this article and post about it. He's like, I got to post about this. But he was saying, you could save your kid's life. I mean, Mom, I hear you say all the time that the biggest reason people die is heart attacks. And kids that are raised plant-based, they don't show any risk of heart disease. So again, all of these different risk factors are happening. And yet the kids that are being raised plant-based from the beginning don't have those risk factors. So at least that gives us some ability to make a difference and not just, because fear is going to make us sicker anyway, right? But to lean in on what we can do to live the healthiest life we can, and then not forget to enjoy it in the meantime, because nothing's 100%, right? As you know.
Yeah. No, but you were diagnosed fairly young when you had your autoimmune disease, weren't you?
16, yeah.
That's pretty young, right?
Yeah, I mean, it feels young to me now, where it's 32 years later, right? Yeah, I was very sick, and I was bottle fed. I was my mother's doctor told her that formula was just as good as breast milk, and that way she could go on a diet and not have to worry about it, right? So formula fed. I was a skinny kid, and back in the 70s and 80s, if you were skinny, it meant eat whatever you want, right? So I was raised on, everyone was always trying to fatten me up, and I enjoyed it. So macaroni and cheese and pizza and all that stuff, it never worked. Nobody could fatten me up. But I was a skinny kid that had no muscle tissue and had lupus by the age of 16 with kidney failure. So, I was told at 16, I had 6 months to live without all these experimental treatments and chemotherapy and all that stuff, which saved my life. But I stayed chronically ill for 12 years of my life, all the way through my 20s, until I changed my diet. So someone like me, who was already in organ failure by 16, could be, now I'm 48 officially, as of a couple of weeks ago. So to be 48 now and have zero risk factors. I mean, I had a colonoscopy, and my GI doctor gave me applause. He stood up. He said, he's like, I have never seen a colon that clean. He goes, you look like a teenager inside. I was like, at least inside I do. But to have, he'd never seen that before. And all he does is colonoscopies. I mean, that's their thing, right? If you go to your GI doctor, you're getting a colonoscopy. And he was just shocked. He's like, whatever you're doing, do that. That's amazing, right? So I'm exposed to all that stuff. I buy my Power Greens in plastic containers because it's convenient. So I'm sure that has some effect. And yet, because I live on this high raw diet, that I'm constantly hyper-nourishing, so I'm hydrated. I've got tons of those raw cruciferous going through my bloodstream at any moment. And I focus very much on living in a place of gratitude and managing stress, and all of those things that so far that has combated my genetics and all of the illness I've had before to keep me really healthy. So that's why I say, sometimes I think people focus so much on what they're afraid of that they don't lead into what they can do. You know, like people say, well, if there's microplastics in the water, should I not drink water? No. What I found is when people drink a gallon of water a day or 96 ounces or more, their health improves dramatically. Whatever's in it seems to not be as effective, just like eating, produce that has, pesticides. Like we still need the produce, right? So I think we have to lean into the things that give us health and then, be aware if you have symptoms or, get your screenings and all of those things. But yeah, I think I'm a good example of what's possible, even living in today's world. I should have been dead a long time ago. And the way I eat and live my life keeps me going in a way that I'm healthier than most people my age instead of the opposite.
Yeah, well, you look great. I'm curious, did you take the sedation for your colonoscopy or did you do it like me with nothing?
Hell yeah, I had a great nap. Are you kidding me? There is no joke. I have actually participated in giving colonoscopies when I was in medical school, and there's no way I'm not taking that nap. So you're
That's funny. That's so funny.
I am not anti-medication. And I think that disappoints some people, but it's because they think you have to treat this like a sports team. Like I am natural, I am pro medicine. I am pro what works. I am pro good life. So, if I try to live my life requiring as little medication as possible, but if there's something that can make my life better, then I will do it. So yeah, I have no problem taking some sedation for a colonoscopy and I had no side effects.
I'm not anti-medication. I'm just a nutcase and I'm just afraid of it, but I'm not anti it. But
see, on my end, I've seen people go through it and how refreshed and happy they feel when they wake up.
It's fun being awake though, because you can watch the screen, you can talk to the doctor.
That would give me an anxiety problem. No. Like I am good with being sedated for procedures. That is perfectly fine with me.
That is just, well, I guess different strokes for different folks. I'm just glad that I'm able to find doctors that will do them without.
There are. Yeah. I mean, I've had folks who tell me that they don't get sedation even for dental procedures and stuff like that.
I'm not, that is the one thing that I always take the nitrous oxide. That is the interesting,
because it's laughing gas and you're a comedian, right?
Exactly. I always say, why can't they just pipe these into the rooms when we're performing, It would be so great.
There's some legal issue there.
You talked about the plastics and I'm trying to think back. I mean, because obviously I didn't eat a healthy diet growing up. So I'm trying to think, we didn't even really buy greens, but it didn't, how were they selling things back in the day? And why can't that be an option today? Because it's not just about the plastics being harmful, but it creates just so much,
the waste. Oh my God.
Yeah.
I know. Yeah. And listen, there are people out there. I don't know if you've ever looked at them before, but there's these people out there who try to get through a year with no garbage. It's fascinating. Like I've seen videos where someone's entire garbage for the year was in like a little container this big, where they're taking their own bags to the supermarket. So when instead of putting, when you go to get even if you get fresh kale, you put it in that plastic bag to take it home, right? So they bring their own and then they weigh it, and there's a whole thing. So it's possible to do it. It is definitely more difficult. And how much damage does it do if it's just temporarily touching it on the way home and then you wash? I don't know. I feel like we have to find a path where we're doing, as well as we can without making ourselves crazy. But yeah, I think that definitely the bigger problem is how processed things have become. I really see that as the biggest issue, especially since, again, I'm working with people on a daily basis that are still exposed to plastics, right? I mean, they're buying their vegetables. Some of them are buying water bottles and their diseases are going away. Like that it's going away as quickly as it's coming on, it's going away. And so that tells me that when the nutrition is optimized, that people get better in spite of the same exposure to the same environmental issues. Now, if you are already sick, can it help to decrease that exposure? I mean, possibly. I just don't know the percentage increase, right? Like if you took all plastic out of your life right now, what would be the change in your improvement compare if you ate the same diet? I don't know. I mean, and I don't think anybody does. So, I think everyone has to decide where their line is of what they're willing to do. There's some people who tell me just changing their diet is more than they're willing to do. All right. For me, I base it off results. If someone showed me that like drinking water from a well created this much faster recovery than drinking water out of a water bottle, I'd say, yeah, do it. But we haven't really seen that. So yeah, I think it's, everyone's got to find their way. I try to use things like stainless steel and stuff like that, but it's hard to even imagine plastic not in our life, right?
It's
So
just,
yeah, I think it's just right now, and I see people even in my smoothie shred group on Facebook talking about this. They're just like, oh, maybe the plastics are doing it. And I have to stop them and say, and yet, if you just do the nutrition plan, the Goodbye Lupus protocol, your symptoms are going to go away and your labs are going to get better in spite of them. So let's just do what we know works rather than flipping out on a possibility of this being an issue, right? If it stops working, oh my gosh, I'm going to be diving in. What happened? Why isn't it working anymore? Right. And then we look. So I always try to solve the problem right in front of me. And if there's not a problem, if things are working well, then we just celebrate like that. It's the same way I treat anxiety. If right now is okay, let's just celebrate that. We don't know what's going to happen next. It might be more good news. It might be bad news, but let's just stay with what's working. Right. So I think, that's an important thing because there's always something in the news that can scare the crap out of you.
yeah. Well, there tends to be this perfectionism among people on a plant-based diet, and there's a saying, don't let perfect be the enemy of the good.
Yeah. Or good enough.
Yeah.
I also think that there is, that sometimes when we start doing the research that helps us get better, people get addicted to that research. And so there's this kind of, paralysis that can come on where it's like, what's even the point of eating better if I'm just going to be exposed to these toxins in my environment and the plastic and this and that, like it's hopeless anyway. So there's two ways it can go, right? People can get to the point where they're not willing to do anything, or even though they're doing well, their anxiety is so high because they're always worried about the next thing that they're creating more inflammation and damage from the anxiety. So for me, I haven't taken all the microplastics out. I tried to, listen, we have a water machine at home, but if I'm out and I'm thirsty, I will get a bottle of water, so it's just one of those things where, since my health is good, I'm not taking the next step. If I have a health problem, I'll be looking on how to solve it. Right. So, and like I said, for my clients, even with cancers, they're using the same foods as everyone else, even with the same exposure to things like plastic, and yet they're doing better. So as long as I see things working for improvement, I think we hold on to that. But there's definitely this attention now in the world of medicine and research, trying to see, wait a minute, why is this only this one group of people under 50 having a surge of cancer diagnoses? And so I think they're looking for every possibility now. And maybe that will benefit us, maybe that's going to bring more attention to all of these problems like the ultra processed foods and everything else that are creating increased risks of not just cancer, but autoimmune disease and, heart disease and everything else.
Yeah. You mentioned that people with cancer often have had trauma. Is that with every disease or just cancer? And maybe next month, the whole show could be about that, but I'm interested and also fascinated by the mechanism by which that works.
Yeah, I think that if we looked hard enough, we would find it in many other diseases. The ones I've seen studied the most have been autoimmune disease and cancers. But any kind of emotional trauma can raise your risk of disease just because they found that people who have trauma, especially acute trauma, like for people in mourning, for example, that their inflammatory markers are through the roof as if they already have an autoimmune disease. So all of those inflammatory markers, when you have chronic trauma, your inflammatory markers are high at all time, which then raises the risk of you activating some of your genes for disease. So it's one of those things where whatever disease you might have is going to become accelerated by that high level of distress that your body's going through. So I think it would probably be found across the board, but I don't know that it's been studied everywhere. I'm happy to look into it for you, though, if you want to make a show about that, see what we find.
I'm just curious because how do you work with people on trauma? Do you do it one-on-one? Do you do it in the group setting of the?
So all of the above. I can't help it. That's just kind of where I am. When I see people struggling, I'm always going to zero in on that. So I do it one-on-one. Also, there are people who book appointments with me who want to just spend, over an hour together where I help them identify what's going on with them and what we need to work on. I also have private rapid recovery where people work with me every day. But in my group too, actually, it's a big part of my group is there's daily work on emotional health. And so it's a really beautiful thing to see. Like right now, we just finished the 4th week. And so many people are saying, like, I have this sense of inner peace that I didn't have before, that I had an argument with someone, and normally I would have been in despair for days, and I bounced right back. Like, I'm managing my feelings. I'm feeling more connected. We're working through forgiveness right now. So there's a daily work on that. Now, if someone doesn't have emotional stuff and they don't want to do the emotional work, they don't have to. But since it's a group, I do it together to help people go through that journey, because I know how prevalent. There was one person in my group that said, now I feel bad that I don't have trauma. I'm like, no, you're good. Just enjoy the food and feel great. But for the folks who are working through it, it is so profoundly important. Especially, a lot of folks will tell me that I was following the diet correctly on my own from your free resources, because I give the information away. But it wasn't until I started listening to you about my self-care and emotional health that I started seeing these amazing breakthroughs. So for me, results are what matter. And if the nutrition alone is working, then we don't need to dive into that other stuff. But if you're really struggling on a day-to-day basis, then a lot of times what's behind it is poor emotional health. And so then I'll start nosing around in there. I tell them, I'm like, let me swim with you in this water. Let's see what we have here. And so, yeah, it's a part of everything I do for people who need it. And the majority of the people I work with need it.
Well, could somebody come just for the emotional part and not do the diet? Or, I mean, not do the protocol, like somebody like me that's already eating pretty good. I mean, I'm doing much.
If you're in it, you're doing all of it.
Okay. You can't just cherry pick the
There are
program,
people who do it for, I've had people join the group now specifically for depression and anxiety, which in the old days, that wasn't the case. People did it, for autoimmune, and then they would do it for other diseases, cancer, heart disease, diabetes. But we do have a lot of people now do it for the emotional benefits. But yeah, you have to be on plan. Like, every day we're helping people do that. And why not? Because at least you optimize recovery in every aspect. The reason it's called rapid recovery is we are optimizing your ability to recover by making your entire life anti-inflammatory. Your thoughts, your moods, your nutrition, everything optimized to see how quickly you can get a result in your body. So yeah, if someone joins the group, they can't, we're expecting you're going to do the full participation, no cherry picking. I mean, we can't stop someone from cherry picking, but every day you'll get feedback that you're off plan, and that'll be sad. Everyone wants to get a good job, right? So, because we look over every person every day. They have to post what they're doing, how they're feeling, all that stuff, and they get feedback every single day. Yeah, we want everyone to do that. Yeah.
Good friend of mine is in your program right now. That's amazing. Diana has a question about your hyper-nourishing protocol, and she wanted to know if it's okay to pre-grind flax seeds and keep them refrigerated for a couple of weeks. I like to sprinkle some on my oatmeal in the morning.
You can do that if you want, but it doesn't count towards hypernourishment. Omega-3 fatty acids will oxidize or break down easily when exposed to air or heat. So if you grind it up, you've now completely opened up those shells and exposed it to air. So if you use it immediately, you're fine. But if you let it sit out, the omega-3s will break down. So there's no harm in it if you want to use it for flavor, but you're not getting the benefit anymore. You want to use it immediately.
That's a good, I didn't know thank you for saying that. I did not know that, because sometimes people buy it already even pre-ground at the store.
Right. And if you're using that as an egg replacer or something, that's fine, but don't use that as an omega-3 source. Yeah.
Got it. Okay, let's see. There was a question on what to do for RA of the thumbs on Instagram.
Nothing different. I mean, you want to do the full Goodbye Autoimmune Disease protocol. So I'll put it this way. So what's known as the Goodbye Lupus protocol, they're named by my books, by the way. So Goodbye Lupus protocol is from my book, Goodbye Lupus, where I teach my story, but also the foods that make you sick, make you well, right? If you are otherwise happy, life is good, then you just add the nutrition from the Goodbye Lupus protocol, and that should help. The Goodbye Autoimmune Disease protocol is named because my book, Goodbye Autoimmune Disease, is all about the other lifestyle factors that affect people's recovery, as well as all the case studies in there. So that includes the self-care and the sleep and the emotional well-being. So for most folks, that's the one to go to, is the Goodbye Autoimmune Disease protocol. Optimize your mental health, your sleep, and get the nutrition right. And that should help you get rid of your pain. In fact, in my group, at the last meeting we had on Friday, that was the end of week 4, 2 people already had labs that proved they'd reversed their diseases. And one of them was rheumatoid arthritis. She was already pain-free, and she'd had her first set of labs in years that were negative for the rheumatoid factor and everything. And it was, we were at the 4-week meeting. So that means it was taken before we even got to the 4-week mark. So that was really exciting to see how quickly, when people actually get their labs back that quickly, it's really exciting. And that was rheumatoid. So, It's a very exciting thing, how quickly people can get better when they go all out on the program like that.
Thank you. Susan would like to know what you think of seltzer drinks that have THC in it. She's wondering because they're plant-based and used medicinally, are there any health risks to using them? I know there's always a trade-off, but I understand they do have a calming effect.
Well, I have not studied how THC would impact my protocols, but carbonated water does create a more acidic environment in the body. So we don't use carbonated waters on my protocols. No carbonation, just flat. So I'm not sure if they sell that, but I'm sure they probably do. But I don't know how it would affect your recovery.
Yeah, so you don't know much about THC. A lot of people are using it in gummies and in all kinds.
Oh, yeah, I know that. So I only speak from results. So I have never looked at what is the result for recovery when people add THC versus when they don't. And so that's why I don't speak to it. Yeah. There are people who use it who do fine, but yeah, I only like to recommend something where I can say I've tested it and I know the impact it will be.
Thank you. One of the viewers on Instagram saying, is it true that type 1 diabetes isn't curable even with a healthy diet?
I think we don't know all the information about what's curable or what's not. But with type 1 diabetes, the cause of it, right, is when an autoimmune disease is attacking your cells that make insulin. So if there are no more of those cells left, if they were completely destroyed, and it usually happens in childhood before people even realize it's happening, if those cells are gone, then it would make sense that there's no way to grow them back. As far as we know, we can't grow back organs. That said, for the people I've worked with who have type 1 diabetes, all of them who've done rapid recovery with me have been able to lower their insulin needs. So whether or not that's because they're producing more insulin or perhaps they had some insulin resistance they weren't aware of, they still do better. But I think we would have to have a much earlier intervention to see, you know, like a newly diagnosed kid, to see if there's a chance to stop the process or reverse it.
Got it. Thank you. Rachel would like to know, does anyone in your program recover with frozen spinach? I need my smoothies super icy. Why not add ice then?
Wait, say the one with cooking it?
Well, frozen spinach. So my
Oh,
understanding,
frozen. Oh, no. So we don't use frozen vegetables. There is a difference in nutrient content, and whether or not it would still be sufficient is a question mark. So again, just go with what works. Put the room temperature unfrozen spinach in and add ice and get it cold that way. As AJ said, there's no reason to use a frozen spinach if you can get fresh.
I guess that for some people, maybe it's more convenient. My understanding, frozen vegetables aren't cooked, but they're maybe blanched, or, you know, briefly.
Oftentimes they are, yeah. And so that you just don't know. So we let frozen fruit by because we're just using it for flavor, not for nutrition. But for the greens, you want to use fresh if you can.
Yeah. Well, you always say just pack it in, but is there a certain amount you're striving for, like a whole pound? Because
Yeah. If you, we put a whole pound in our blender, but a pound a day helps keep the doctor away. So if you don't want a whole pound in your blender, then eat the rest of it in your salad, and then you got it.
Right. Thank you. Let's see. I don't know if you can speak to this, but there's a question. Along with good nutrition and avoiding certain factors, what do you think about IV infusion during proton therapy for prostate cancer? I don't know if that's your
I don't
expert.
have enough information to give
Yeah.
you an opinion on that. Yeah.
Yeah, absolutely. Well, they took the time to write it, so I thought I would, you know. So let's see. Okay. What about too much spinach and calcium absorption? Asks Elizabeth.
I have never seen a problem where people are having trouble absorbing a sufficient calcium on my plan, but understand that with hypernourishment, you're overdosing in nutrition. So people are eating these foods all day long, and they always end up with higher nutrient levels across the board than before. So I have not seen that be a problem. But you know, sometimes people will latch on to these things and then make it an issue. You don't have to. If you're worried about spinach, you don't have to eat spinach. You can just stick with cruciferous vegetables, and then you can just take that worry right out. But I have not seen that be a problem.
Do you have Costco near you? Because my favorite
Oh
is the
yeah.
bags. I love the bag, and it's I guess it's in a plastic bag, but it's not in the hard. You know, when you talk about plastics, do you mean an actual plastic bag or like the actual hard plastics or both?
Either one, but yeah, I like the Costco Power Greens because I get 24 ounces.
I love those.
And we get like 4 bags at a time. Yeah.
I mean, the price is fantastic because, you know, I find it, whether the plastic is healthy or not, I find when it's in the hard plastic, I just can't fit it in my fridge. But with the Costco greens, I can like kind of smush it and get it in the drawer. I love
It
those.
does fit in the drawer better, it's true. But
I
yeah,
love
we get
those.
what we can. Some people have been telling me lately that their Costco stopped carrying power greens, which is very sad. Mine still does. So yeah, we usually get that just because the bulk of how much food we need. Yeah, it's much
Same here.
better.
I love those. Jennifer says, why does carbonated water turn acidic? I wonder.
They just looked at the effect of carbonated water on the system. So when you're looking at your pH, like looking at your urine pH, and found that it creates more acidity.
Great.
Yeah.
Jerry's wondering about oxalates, and especially in spinach. Is it really a thing?
Well, there are oxalates in spinach, but whether or not it's a problem, typically no. So again, a lot of times there are these kind of alarms that are sounded, but they're not really for real fires. I think that the main issue is because when people get kidney stones, they are oxalate stones. So then somebody out there in the world of memes or whatever decided that that means if you eat oxalates, you're going to have more oxalate stones. But the science has proven that's incorrect. In fact, they did a study where they looked at people who had a history of kidney stones. And they thought, okay, if oxalates are in vegetables, then what we'll do is we'll take them off the vegetables, no vegetables, and see if the oxalate stones go away when we remove the source of the oxalates. And what they found is the people who were taking off all vegetables had more stones. The people who ate mostly vegetables had less stones. And the reason is because eating vegetables, including spinach, makes your urine more alkaline. And alkaline urine keeps the oxalate dissolved so it can pass through in your urine. When your urine becomes acidic, then the oxalate comes out of solution and forms a stone. And that will create the kidney stone. So it's not just oxalates, but it's how alkaline your diet is. So for most folks, when they add hypernourishment to their diet, their stones go away. My husband used to get kidney stones before we got together, but he was on a high meat diet. He was on a very clean diet, no processed stuff. It was meat and vegetables and things, but he had multiple stones that he had to pass. Since he switched to plant-based hypernourishment, eating tons of spinach, he sometimes will make a smoothie with only spinach. He's never had a stone since. So there are some people who have a genetic disability to manage oxalates, and no matter what, if they increase things like spinach or anything, they will have them. But for the general public, we actually will get less stones when we incorporate that into our diet. I hope that helps.
Thank you. I know you have to leave a little bit early today. So we look forward to seeing you on the 5th Monday of March next month, which is the 31st.
Awesome. It's so great to see you.
Same here. When does your next program start? Because people are saying, how do they register? If you're watching on Instagram, you can't see show notes. You have to hop over to YouTube, and then there are clickable links.
Okay, so my next rapid recovery group is March 28th, and that's already enrolling. So if you go to goodbyelupus.com, you can click work with Dr. G, and then you'll see appointments and then rapid recovery. So March 28th is our next group. That's actually the soonest way to work with me right now would be the next rapid recovery group.
That's Friday. Thanks so much.
Thank you. It's good to see you. Bye, everybody.
Take care, Dr. Goldner. Thanks all of you for watching another episode of Chef AJ and Friends. Please come back on Friday at 10 a.m. for the Q&A with Dr. Ron Weiss. We call it The Doctor Is In. And please submit your questions in advance because we keep them. And then if I don't get to them one month, I can get to them the next month. And then we email you actually and tell you when they were answered. So you just go to help@chefaj.com and you can sign up.